Right, now here we introduce Eddie, my beautiful boy. Unfortunately, he's got diabetes just recently. Okay, but so what I'm going to have to do now is take a blood test from him. He's normally quite calm. Sometimes he flicks his ears a little bit back, but he takes it in good spirit, I think. Give him a treat afterwards. So what? All right, Eddie. All right, sweetheart. Oh, my beautiful boy. Beautiful boy. Right, now I'm going to flick this light on because it makes it easier to see the vein on his ear. I have washed my hands, which is very important. Hygiene, yeah. Because you're dealing with blood. And what I'm going to do is warm up. There's a vein across there. You see, right along the edge. There's a vein right along the edge there. Just warm it up. Now normally, in the first place, I was supposed to use a pen with a pin inside it to try and get the bloods. But it was so awkward to try and get that tiny vein that I do it manually now without the pen. Just warm it up, get a bit of flow of blood. I get the little gadget. What I'm going to do first is put a little bit of cotton behind the ear. Not only does it stop you pricking your own finger in case you go through, but it helps afterwards. So what I'm going to do is just a tiny pinprick. Yeah, often he's got this ear pinned back. He's a good boy. We're just going to do this test now, darling. Just a little prick, little stab. So I felt a little stab there. Draw a tiny bit of blood. Tiny bit of blood. Anything coming? No, we'll try again. Doesn't need much. That's a bit coming. Right, so in here, I've got this this gadget here. I've put the going to put the strip in. Waiting for the reading. Waiting for the reading. It's waiting for that. There we go. So just on the edge. All right, Eddie. All right, darling. Good boy. Good boy. Just touch the end of that blood drop. There we go. It's reading. And what I'm going to do is a touch of antiseptic cream. I'm just going to put a little bit on there where the blood is. With this little bit of cotton wool should help to mend the wound. And my finger. Mend the wound. That's fine. I'm looking at the thing. The gadget says 16.6. So it's not much different than breakfast time. This is an add-on test because he was a bit sick last night. And he's a bit down on his appetite. I'll just hold that there. Stem the blood flow a little bit. I've got to remember 16.6. Pen's disappeared. That figures. Just nice. You're a good boy, aren't you, darling? 16.6. That's good for you, darling. Hey? Oh, we won't need to do it again for a little while. One more extra one this afternoon, and again at tea time. That'll give a little curve for the vet. I've got a chart. We record these measurements. This is what they call a curve, just to see how you've been doing through the day. Normally, I only take this twice a day, just before insulin, because it would tell me how much insulin he needs, if any. He's a good boy, brilliant boy, fantastic. There we are. Now we're going to give him some treats. There we are, you beautiful boy. I'll give you some treats. That should be it. Just make a record of it on the chart.